There was a researcher who said the only way to resolve this would be to find an entire mummy of a T-Rex. There's no way to resolve
Couldn't
this
we do
conflict.
the Jurassic Park experiment?
Yeah, why can't we just do that?
I know.
And clone a dinosaur and see if they got
Maybe we
lips?
should start with Beethoven. We could clone Beethoven.
Beethoven had lips. We do know that. Welcome once again to Free Associations from the Boston University School of Public Health, the Public Health and Medical Journal Club podcast for anyone who is as confused by the latest health study as I am by when is the appropriate time to fill up your gas tank. Survey that. I want to know the answer.
30 miles left or less.
30 miles left or less. So has the light gone on, the warning light?
Yeah, the light goes on at around 60, and I wait until it gets to the point where it no longer tells you how much gas it thinks it has left, which for me is at 30 in my car.
Okay, definitely.
Then I know it's time to get gas.
It's definitely wrong answer. Jess?
I've had different stages in my life in relation to this outcome. Right now, at this moment in time, I usually get it when I have about a quarter of a tank left because I'm terrified of being stranded with like screaming children in the back. But I've definitely had times where I don't get gas until the light comes on, and sometimes a good while after that.
So this is a constant debate in my household that was made more transparent by the fact that one of my children asked, when is the appropriate time?
Oh,
and
dear.
so then it had to get relitigated. The correct answer is when you've hit 3/4 of a tank. I mean, you're pushing it at that point, right?
So you're down to a quarter.
No. You're down to 3/4 of a tank left. You're pushing it a little bit, but okay, you can wait. But
That seems very early to me.
I'm this is the reputation that I have in my household. I believe it's at a quarter of a tank. You never want to go less than a quarter of a tank left. Whereas other people in my household like to see that
the
light
danger,
come on.
right? But it's like a little bit of living on the edge.
This is
right.
part of
Aren't
what I
you
hear.
curious how far the car will really go?
No, not at all.
That's it, right? And maybe at some point you'll have to figure that out.
I actually read somewhere that there is a reason to do it earlier, so that your rationale has some support, which is that gas tanks, particularly I guess older cars, which had steel tanks, and I think they're aluminum now, would get rust in them, and so the rust flakes would settle to the bottom and get slurped up as the drawing apparatus would go further and further down the tank, and so you can clog up your intake tubing.
Okay.
This is what I've heard. I have no idea if this is true.
So what I'm hearing is I'm right. I just let's conversation ended.
That is way. However, I have not actually run out of gas since I was in high school.
I did once when we lived in South Africa, and the gas gauge was broken, and I just could not judge.
I don't think I've ever run out of gas.
Yeah, it's the only time it ever happened to me.
It's awkward when it happens, but then you have to walk.
Well, I'm Matt Fox from the Departments of Epidemiology and Global Health at the BU School of Public Health, and I'm joined once again by Dr. Jessica Liebler from the Department of Environmental Health at the BU School of Public Health. Welcome back, Jess.
Thanks. Happy to be here.
And I'm also joined once again by Dr. Christopher Gill from the Department of Global Health at the BU School of Public Health. Welcome back, Chris.
Hey, Matt. Hey, Jess.
And as a reminder, head on over to the Population Health Exchange website at pophealthex.org. That's BU's hub for lifelong learning. And another reminder, give us a rating on your iTunes or your Stitcher or wherever you get your podcast, because we have 2 new reviews.
Two?
Whoa.
Yep.
Wow.
So first one says, amusing, informational, and just delightful.
Oh, gosh. That's nice.
5 stars. I discovered this podcast while I was completing my master's in public health and have continued to listen to it as they never fail to discuss interesting and topical studies. And you are guaranteed a few laughs and chuckles along the way. Great work, everyone. Keep them coming. I highly recommend this podcast.
Nice.
I can't read it says Mummy 63920 $622. So
That's the name of the person. Is that phonetic?
could be real, could be a bot. I don't know. And then the second one, excellent podcast, a good balance between seriousness and lighthearted moments without ever feeling like an overload of information and not informative at all. I've even included it, meaning it doesn't feel that.
No, this is good. This is good.
I've even included it in the recommended literature for my epidemiology students. I'm not entirely sure they listen to it, but they should if they want to know where I get some of my ideas for exam questions from. Nuno. So
that's so cool.
Yeah.
That's very nice.
That's awesome. So anyway, now onto the show. So today, in our first segment, which is our Journal Club segment, we're going to look at a study on COVID interventions, a dense study with a lot of information. Then in the second part of the podcast, assuming we have time, given how much there probably is to say about the first one, which is our deep dive, we will talk about the idea of living evidence syntheses and whether or not we think they are going to solve all of research's problems. And then our last segment is our Amazing and Amusing, where we'll get into some things that make us laugh out loud or we just find interesting. Okay, so segment one. So the article we're talking about looked at COVID interventions, as I said. It was published in The Lancet entitled Assessing COVID-19 Pandemic Policies and Behaviors and Their Economic and Educational Trade-Offs Across the U.S. States from January 1st, 2020 to July 31st, 2022, an observational analysis by first author Thomas Balaki of the Council on Foreign Relations in Washington, D.C., but I think it's probably also worth noting a large number of the authors were from the Institute for Health Metrics and Evaluation. Is that what it is?
Yes, and there was a lot of them.
And there was a lot of them. And I bring that up only because much of the data that is used in this comes from IHME. Some headlines on this one: why the COVID-19 death rate varies dramatically across the U.S. That was from the University of New Orleans Public Radio. When it comes to preventing COVID-19 deaths, how we feel about each other matters. Yahoo News. And then the last one, and I chose this one only because it's representative of something, which is Mountain West States COVID-19 death rates stand out in new analysis. That's from KPCW. That is from a news station in the West. And I point that one out because there were a lot of these headlines from different news outlets across the country that picked out
their state
from this analysis. Sure. And sort of use this as like the scoreboard.
What about the state of mind?
That was not in there. And there is no radio station that I know of.
My two favorite states. Yeah. And then there's Rhode Island.
And then, which is an island.
Right.
It's not an island. Why is it called Rhode Island if it's not an island?
It's near Greece.
Jess, can you walk us through this very complicated study?
Oh my goodness, I'm happy
so glad that you're doing this, Jessica. Can I just say, I started reading this today, and I'm like, I only have 3 hours until this podcast, and this is going to take 3 hours to try to understand this piece.
I was glad that you did the Cochrane review last time, which was long.
Well, I just said they had meta-analyzed a bunch of studies, and they came up with some results that we disagreed with, so it was pretty light.
Well, I would say I have 2 pages of notes on this study, and so I've asked Matt to just give me the let's get it over with hand signal where we're going to wrap it up. So he'll do that. But the question is almost like what was not analyzed in this study as it relates to COVID. This was a paper that I'll just note up front had 58 co-authors. So there were many, many people, and they came from many institutions who were involved in some aspect of the data gathering or data analysis. And we've spoken as a group about what constitutes co-authorship. But this is a big group. So kind of even just reflecting the huge lift that this paper was. Yep. I'm just going to read the first sentence of the abstract because it's great in that it defines the core question that they're asking in this paper. The USA struggled in responding to the COVID-19 pandemic, but not all states struggled equally.
Yep.
And they're asking why. Why is that the case? Why? And they're trying to identify factors that led to this cross-state variation in COVID infection and mortality rates. And the authors note up front that some states in the U.S., like Vermont, Utah, and Washington, for example, had COVID death rates similar to Denmark and Switzerland, and Germany, which were least affected by the pandemic, while other states in the U.S., like Mississippi, Arizona, and West Virginia, had death rates more than 3 times higher, Utah, Vermont, and Washington, and were akin to the most affected countries of Russia, Bulgaria, and Peru. So obviously, the United States did not have a single or unilateral experience with COVID. And these 58 authors ask, why was that the case? And so what they do is they frame their many part analysis into 5 core questions. They ask about these 5 issues and how were they associated with COVID infection and mortality on the state level. Their first series of questions focused on inequities and inequalities, social, racial, and economic inequities by state. How were those factors related to COVID infection and mortality? They next turn to healthcare systems and public health capacity at the state level. They then focused on politics, looking at the political affiliation of the governor of the state and the proportions of residents voting Democratic and Republican in the 2020 presidential election. So this was a metric of political affiliation and also partisanship. Then they turned to policy issues, and they asked whether policy mandates, such as mask mandates, vaccination mandates of state employees, shutdowns across businesses and schools, for example, were these associated with better COVID outcomes or worse outcomes. And then they looked at the association between COVID infections and educational and economic outcomes. The educational outcomes were reading and math scores in 4th grade, for example. So they had these kind of 5 key issues: social, racial, economic inequity, healthcare systems, politics, policy mandates, and then this issue of whether or not there was an association between COVID infections and some of these educational and economic outcomes on the state level. Their study period ran from January 1st, 2020, so a couple months before the pandemic, to July 30th, 2022, and they were using an ecological study design, looking at data collected on the state level. As I said, they were drawing on vast quantities of data, most of it which was publicly available, to answer these questions. They estimated daily COVID deaths for all states using data extracted from the Institute for Health Metrics and Evaluation modeling database, and they noted that these data were adjusted for underreporting, which varied on the state level. So it was more of a modeled mortality endpoint. And using this daily data, they also calculated the cumulative death rate over their study period. They then used indirect age standardization to adjust each state's cumulative death rate to reflect the national age distribution. And then they did a couple of interesting things. In thinking about comorbidities, the authors noticed that prevalence of various COVID-related comorbidities would vary by state. And so they used principal components analysis to develop a single metric of comorbidities. And then they used that metric, the first component, in their PCA analysis as a covariate in later regression models as a metric adjusting for confounding for comorbidities across their later analyses. And so what they were looking for, they were saying, what is the cause, what is responsible for remaining variation in COVID infection and dates after adjusting for this package of comorbidities and adjusting for the age distribution of a specific state. So some of the variables that they focused on, just to give you a flavor for some of these variables across their 5 topic areas. So in the social, racial, economic inequity factors, they were looking at poverty rates, level of income inequality, something they were using the Gini coefficient, mean years of education, race and ethnicity, access to paid sick leave or family leave. They also looked at these metrics of trust, which someone noted in the media report in terms of interpersonal trust and also trust in institutions. For healthcare access, they were looking at an index that I think is created by IHME to reflect healthcare access in the state, number of doctors and healthcare providers per capita, number of public health spending per capita, the percent without insurance. For partisanship, as I mentioned, they looked at the political affiliation of the governor at the time and also the proportions of the state population voting Republican or Democratic in the 2020 election. For policy issues, they looked at closures of bars and restaurants, masking requirements, vaccination mandates, stay-at-home orders. They also looked at some interesting population behaviors on the daily level, kind of like mobility, using GPS data, estimates of mask usage in addition to mandates from, they called it the premise study, that estimated mask usage, vaccine coverage on a daily basis. And so what they did is they regressed each of their standardized outcomes, the death and the infection rate, with this PCA comorbidity variable, and then each of these other independent variables separately. And they did that because many of their factors are correlated. So they did a series of independent regressions looking at probably 100 predictor variables in conjunction with the age standardized death or infection outcome data and the PCA comorbidity estimate. What did they find? After doing this bulk of analyses, they started off by in a descriptive way showing that the state that had the lowest standardized COVID death rate was Hawaii, and the highest was Arizona. They provided some cool figures. They had lots of cool figures, I thought.
They did.
And they had some nice color-coded figures showing how the relative death rate varied if you standardized or didn't standardize, but it kind of ran from Hawaii to Arizona in their standardized assessment. They found that racial and economic inequality and political partisanship at the end of the day were the variables that were most strongly associated with COVID mortality. Higher rates of poverty, lower rates of education, infection and the greater proportion of people identifying as Black or Hispanic were also associated with the highest cumulative death rates by state. Higher interpersonal trust, as measured across a number of their different metrics, were associated with lower COVID risk. Interestingly, greater public spending on public health was not associated with reduced COVID risk on the state level, but access to quality care was associated with reduced risk. And there were some interesting distinctions by political orientation of the state that we could potentially talk about. The political affiliation of the state governor was not associated with the COVID death risk, but higher proportion of voters voting Republican in the 2020 election was associated with higher COVID death rates by state. Some protective mandates, including mask use and vaccination, were associated with lower death rates, but they found that the state GDP was not associated with death or infection. The results about economic and unemployment were a little bit more mixed. So state GDP was not associated with death or infection rate, but states with greater unemployment were associated with increased infection rate, but not mortality rate. A little bit of some nuance. And some of their package of policy mandates were associated with reduced scores in math, but not reading at the 4th grade level. So in conclusion, what they're concluding is that the poor performance, and this was an elaborate discussion section, the poor performance of the U.S. during the pandemic is the result of what they're calling a syndemic, centered around the combination of race and politics, with between-state variation driven in many ways by inequality and by political orientation.
Okay, can we just take a moment to applaud that? That was impressive. That's a really complicated study.
It's a really complicated article.
So being able to boil that down into a summary like that was really impressive.
Thank you.
There is so much going on here, and I think there's a ton for us to talk about. Chris, you wanna start us off? What are you thinking?
I actually sort of struggled with where to begin because there are so many interesting pieces to this. Starting with what the heck is going on with Hawaii? Like this, in every analysis they did, Hawaii is this extraordinary outlier in terms of the lowest, health impacts, but also in these sort of scatter graphs where they're looking at these different relationships. Hawaii is always off in its own corner. It just seems to be its own thing, and everyone else sort of clusters in a big kind of cloud. But Hawaii stands alone, and I'm trying to figure out what is so different about Hawaii. I don't know the answer, but it just sort of stood out that HI on those graphs seems to sit alone in a corner by itself each time.
Yeah. So, I mean, I don't know what to make of a lot of those things. I mean, Hawaii does seem to me uniquely
kind of a different place.
Yeah. I mean, it is an island way out in the Pacific. I mean, it was just different. It just had different things going on, but I hear you.
Maybe being out of doors all the time because the weather is perfect, that goes a long way.
Certainly, I mean, they also would suggest here that Hawaii is a fairly young state, and I struggle with how to interpret these, but I believe has a positive comorbidity profile, so less comorbid disease.
They had very high vaccine uptake and very high mask utilization.
So those certainly could be contributing, but I also think, they are uniquely poised. I mean, it's kind of like, talking about New Zealand's response and saying, why didn't the U.S. do the same? I mean, I wish we had done some things that New Zealand has done, but we couldn't, completely isolate the United States the way New Zealand did. So I think that one's a little different.
So the one thing I will sort of say about the methodology is that this is all, and you said this earlier, this is an ecological analysis. And so all of these things are proxies for stuff that we can't quite measure to a more or lesser degree. And we don't really know to what more or lesser degree. We do know that a lot of these variables were highly correlated, and hence they use this principal components analysis. But it makes it very difficult to sort of parse what happened. And on top of that, they are presenting these outcomes as sort of the aggregate over a several-year period. And we know, of course, that things were tremendously in flux and behavior was changing rapidly, and there were vaccines and there weren't vaccines. So there was a lot of stuff going on that kind of gets averaged out of this. But there were a couple results that I thought that kind of caught my eye. One was on the policy side. And I don't know if you were, interested in this as I was, this issue of the relative impotence of mask mandates in terms of COVID infection rates or COVID mortality. And in fact, in both cases, the point estimate for these, if a state did or did not have a mask mandate was very close to there being no association at all. Whereas the actual rate of mask use, which is different from what the policy is, had a fairly profound effect on reducing the impact of particularly on COVID infection rates, and to a possible degree mask use, though it wasn't a mortality, though it wasn't statistically significant. And then of course vaccine coverage, the results there were really unambiguous. That was the strongest, most consistent protective result.
More vaccines.
Vaccines apparently stop you dying of COVID, which I think is not really a question that needs to be proven again and again. I think we can all just say that, yes, here it is again. But I am interested in your thoughts about the mask mandate versus mask efficacy thing in light of the meta-analysis we did on the last episode, where it seemed that, in research settings, it was hard to demonstrate a benefit of masks as well, at least for previous respiratory illnesses other than COVID.
Well, so let's take that on. But in order to do that, can we back up for a second? Because I think there's a bigger issue. You sort of hinted at it in the beginning about the ecologic nature of this data and whether or not we really believe we can actually get at causal effects here. I mean, ecologic data, meaning we're not talking about individual level data where we can assess, does wearing a mask or being vaccinated protect the individual? Mm-hmm. It's, do more masks or more vaccinations correlate with states with fewer infections or fewer deaths? And while it seems logical that if there's a relationship there, it must be therefore at the individual level, we know that differences in confounding patterns can also explain some of those differences. They say in the beginning, notice they refer to this as an exploratory analysis.
So what's coming next?
If this is an exploratory analysis, then by definition, we're not getting at causation, right? I mean, they specifically say causation. Right. Then they say things like, if Oklahoma had implemented the policies of California, they would have had X% fewer infections and death.
That seems to have a different nuance to it.
You cannot make that statement. That's a counterfactual. That's a causal statement. Right. If they had done this, this would have happened. Implies the estimates we're getting here are causal. So I feel like this is a study that really can't get at causation. I mean, it can, I don't mean to imply you can't get anything out of this, but it's harder to get at causation. They nod to the fact that you can't get at causation. Then they proceed to, and it's not just that one example. There are lots of cases where the language here makes it clear that, they
assert causation,
or at least they believe it's very likely,
very closely. Yeah.
So when you get into questions of the specifics around the policy, I mean, I don't know what to conclude exactly, other than I have some skepticism about whether or not we're really looking at pure causation. In other words, I think there's causation in there. But I also think, it's very difficult to figure out exactly what the comparison is we're making here. Because if we say, states with more masks have lower infection rates or lower death rates, you might infer from that led, one caused the other. But we also know that mask mandates didn't, part of the reason mask mandates didn't work well was because a lot of people who were going to mask or be susceptible to the effect of a masking mandate were going to mask whether or not there was a mask mandate.
Right. And conversely, a lot of people were never going to do it no matter what you tell them.
Exactly. So when you compare across, you're comparing different states with different masking rates.
And different cultures behind them.
It's not exactly what would happen within the state if, they had or didn't have the mandate. So it's complicated. There's another place where this comes into play, which is, they look at a number of these interventions and say they had an impact on infections, but no impact on mortality. Logically, there's something wrong there, right? The only way you could not have an impact on infections but have an impact on mortality, or let's say vice versa, is if you've got more vaccinations, and therefore, you're sort of having a more, the same amount of infections,
but the
fewer
consequences of those
deaths,
are right. which is plausible,
absolutely plausible. But one is contingent on the other. In other words, they separate out infections and deaths here when in fact one is contingent on the other. So the comparison is across states with different infection rates, not within a state saying if this state had lowered its infection rate, what would be the impact on mortality given their vaccination rate? So it's, these are complicated questions. They've got impressive data, although I do question the quality of some of the data, but generally speaking, they have lots of data, really interesting stuff. I just don't know exactly what to make of it.
There was so much to like here.
Yep.
And in terms of just the audacity of doing this analysis and the boldness of saying we're going to try to look across all of these different domains and collect all this data and work with this huge group of collaborators. The part that I stumbled on was exactly what you're saying, where they would say, if a different state implemented this package of interventions, this would have been the reduction in the death rate or the infection rate. The challenge there to me was the issue of diversity. Of social, economic, racial, ethnic diversity. And the states that had the lower death rates are states in the United States that were less diverse. And there is something in that issue, I feel like, that was important here, that they captured. And so they were saying there was something in inequity. There was something in diversity and inequity that was driving something, but it's clearly not causal. It's clearly not causal. And obviously you can't put your finger on what's going on, but it speaks to not being able to effectively take a package of interventions from one place and then plant them in another place and expect that they're going to work the same way.
Mm-hmm.
This bothered me about this analysis. So they specifically adjusted these estimates. And these adjustments are kind of wild if you look at them, right? I mean, West Virginia goes from being a state with one of the highest death rates to being one of the states with the lowest death rates after you adjust.
A striking shift, yeah.
Whereas Utah goes from being one of the best to one of the worst, as does Alaska. I mean, there's like
this was after you adjust for age.
After just for age and
the comorbidity.
And comorbidities.
Yeah.
So those are having a real impact on these estimates. Mm-hmm. And I have to say, there is a part of me that wonders how much of this analysis is driven by a few states.
Right.
Because, when you talk about a lot of these things, I mean, if you believe these data and these results, Florida actually comes off looking better than Massachusetts. Mm-hmm. And so to say, proportion of the state voting for Trump or vaccine or whatever, that doesn't fit this mold. And so you do wonder, is it a few states at the bottom of the distribution and the top of the distribution that are driving these results? But anyway, so they adjust for age, they adjust for comorbidity, saying if Massachusetts had the age and comorbidity pattern of Florida, or I forget what they're using as a standard, but if they were equivalent, then the intervention would have, this much effect. But we're not going to adjust for differences in racial composition.
Because Vermont is never going to become New Mexico.
They say because that is not something you can change. But of course, it isn't really the racial distribution. It's the immense inequities that we have in the United States. It's the racism. It's all of the components of
poverty,
that,
the crowding
that go with that, and that is something you can do something about. And so I feel like they just sort of ignore that as if we would just leave that because that's not something you could do anything about. Of course, that's something you could do something about and something we should do something about.
And the states that had the greater inequities were also the ones that reflected more political polarization. And so they weren't, making a comment as to what's causing the other. But I thought, that was an interesting component too, that they were saying a lot of the differences on the state level seem to be driven by these inequities that we see in states that seem to have more diversity, and then there's more inequity, and then there's a greater case burden, and there's also greater political polarization. And so I was thinking about you, Matt, as I was reading the discussion section, because there was a lot of narrative. There was a lot of interpretation and a lot of commentary about what they thought their findings could mean. And I liked it from a narrative writing perspective that they talked about this, they call this endemic, of this intersection between inequality and politics, and that was behind a lot of the differentials in the case burdens and the death burdens that they were seeing, but then didn't go into, they kind of didn't take it a little bit. I kind of wanted a little bit more of and they couldn't go anymore. It was an ecological study, right? But anyway, I was thinking of you as I was reading the kind of, it was almost like a narrative retelling of the complicated, complicated findings.
Well, I agree with the both of you, and it felt at the end of this was really 5 manuscripts embedded in one, right. And it maybe would have been better to present them as 5 separate papers rather than trying to put them all in one, and just because it was in the end it becomes somewhat overwhelming to try to make sense of this.
And it also
Still,
swamps.
I applaud the amount of work that went into this.
Yeah.
Astonishing. And it was meticulously thought out. And I thought that their use of the PCA to sort of deal with these covariate structures was very shrewd. I was kind of intrigued by the trade-off analysis that they did, the latter part where they're looking at the educational costs associated with the lockdowns as well as the GDP costs. And it caught my attention, of course, because this is the argument that presumed candidate Ron DeSantis has been making about the Florida response to COVID, that they had a less aggressive lockdown, less briefer mandates, later mandates as well, no vaccine mandates, but rather just encouraging. And look how well they did. This is what he is claiming, that there was a miracle, and that his sort of refusal to be cautious was in some way, the right decision. And on some level, these data support that argument to a degree. And yet, at the same time, it does seem that this is more complicated. In the same way, I think I'm reluctant to draw cause and effect conclusions for many of these results. I don't want to give Mr. DeSantis too much credit for what they did, because I think it's just the analysis and the data going into it are so noisy. There's so many factors behind each of these stories that we just got to be really careful and say, at the end of the day, it is interesting that there was a huge spectrum of success in terms of how we manage the COVID, and that describes our country well as being an enormously diverse and complicated country with a tremendous degree of inequity. Comparing it with Switzerland is not very helpful,
right?
Because the United States is not a small monolithic country in the center of Europe with a very small population.
Yep.
Could I make one comment on the educational side? I would have really liked that to have been a separate paper, because I felt like some of those findings were really interesting and were just kind of swamped. Like I
thought that was the most interesting part of the whole thing was the educational stuff, because I felt like a lot of this stuff, great to have, another approach to it, great to have more specific estimates, but we knew most of the things in here, right? I mean, we didn't necessarily know state by state each one of these numbers, but we knew a lot of these factors. But the educational stuff we've been struggling to get good information on. So I thought that was actually the most interesting part.
I thought it was really interesting. And also just that, there were declines in reading associated with presumably remote schooling. It was with math, but not with reading. Mm-hmm, was that what it was?
That's right.
And that I was like, why only math and not with reading? Like, are reading scores more robust to these kind of disruptions? That was the real policy relevant question. Like, as a parent, I was like, I wanted to dig more into this. And it's very political right now with Ron DeSantis. The question of, the authors were making the comment that educational scores were decreasing in the country prior to the pandemic, that from 2019 to now, there's been this decline in these scores. And so, the issue of whether or not there were more rapid declines in certain states was very hard to know. Very hard to know, and very interesting, and very policy relevant right now, very politically relevant. And I would have loved another paper on that.
I would too. So let me go back to the very beginning, because this study opens up by saying something along the lines of, this analysis could offer clues as how to respond better to a next pandemic. Does it? Or, is that just something you say as a sort of an intro to a paper, or do they really mean that? Because again, Florida is never going to, it's not like we didn't have a pretty decent idea of what to do. I'm not saying we knew everything. We certainly, there are definite questions as to whether the trade-off between, a lockdown in terms of prevention of death versus the subsequent impact on children. So I'm not trying to say that we knew all the answers. But, we had a pretty good idea of some of the things that we could try, as well as how acceptable they would be in various states. And that's not something we're going to be able to change next time, right? Massachusetts is going to react in a certain way that is more towards the, I'm going to say conservative, but you know what I mean, more intervention. Florida is going to have less intervention. That's going to be moderated by what the next pandemic is. Hopefully there is not a next pandemic for a long time, but if it's something more severe, people might react more severely. If it's less severe, people might react less severely. Be clear, I'm not implying this wasn't very severe. I'm just saying could have been even more severe. I don't know that this necessarily is going to tell us what to do.
What to do other than
be less polarized?
Be less polarized and invest more aggressively in the healthcare system. Expand Medicaid.
Although health spending healthcare spending was not related to better outcomes, which actually I have to admit is not very surprising, given that we've certainly known for a long time that as a country as a whole, we spend more on healthcare than any other country and get worse outcomes. So why would it be any surprise that within states, spending more on healthcare doesn't really get you very much?
Yeah, one of my takeaways from this paper was this issue again about inequity and kind of income, racial, social inequity, and the implicit idea that reducing inequity was good for health, and would be good for health. And even if you don't know exactly what are the components of inequity that were driving this, we don't know exactly what were those components, but we know that there's all these corollary factors involved with inequity that are bad for health. And that's a really complicated area. Kind of what do you do to reduce racial and social and economic inequity? But the states that did better were states that had less inequity. And the states that did worse had more inequity. And so it kind of brings it back to this this conversation of disparities and health disparities and kind of how do we maneuver in that space, and that it's, for the ultimate benefit, but it's very challenging.
If we don't tackle that, we do we have the same results next time.
Hopefully it won't be worse next time.
Okay, shall we move on?
That was a depressing way to end it.
Yeah, sorry about that.
That's jolly.
All right, so let's move on to our second segment, which is an article a short article from STAT called Strengthen Science by Funding Living Evidence Syntheses by Jordan Dworkin and Julian Elliott. And this article was motivated by a paper which found that disruptive science has been on the decline, that, effectively breakthrough papers, the breakthrough science that's been found in many fields has been declining over time. And they believe that part of that has to do with the fact that there has been this massive expansion in the amount of available information to people, that it's very hard to be aware of everything that's going on, and, that people therefore are incentivized to really only focus on incremental change. I think you could probably combine that with the, incentives around what we consider to be helpful in terms of promotion in academic circles may also, play some role in this. And therefore, they promote the idea of living evidence syntheses as something that will help transform this problem. So effectively, we're talking about large syntheses of evidence on a particular topic that are effectively in the public domain, that are constantly updated with all the new information, so that you have a place to go as a scientist to identify where the missing information is so that you can then fill that gap, but also that you don't have to start from scratch to try and figure out what's known, and that you aren't in the situation of cherry picking the information that supports your hypothesis, right? It's all there and it's all summarized. I'm curious what you all think of this idea. I mean, I think it's a good idea to have living evidence syntheses, right? I mean, this is obviously a good point, but could we really have living evidence syntheses on every topic?
No.
Probably not. So we're going to pick the things that we think are most important.
But then how do you curate that? Who decides? I mean, who decides what's right and what's wrong?
Don't we in some way have these? I mean, isn't that what the Cochrane reviews do to an extent? I mean, they don't.
Conferences when we go and argue with each other.
They're not the same. They're not the same as what they're proposing. Now, I just want to say they claim this would do the following: promote transformative science, tame the burden of knowledge for new researchers, direct scientists towards critical knowledge gaps, support evidence-based decisions in policymaking, and create a new opportunity for early career funding. I mean, really? Is this the biggest problem? Evidence overload is the reason why we're not having more breakthroughs, as opposed to, couldn't it just be like there are fewer breakthroughs possible? After a while? I don't know.
I know I did not. Did either two of you read this paper that set the academic world abuzz?
I didn't read the original one.
Claiming that there's less transformational science than there was before?
No.
I saw it when it was making the rounds, but I didn't actually read it. No.
Yeah. Well, we should pull that one and maybe consider it in a future episode, because I'd like to know why they believe that is true.
Yeah.
Because I'm not sure I would have thought that was true.
It might vary by field.
I don't know.
So it does vary by field. Yeah. So they do actually talk about that. And our field of health research was one of the least problematic. So I shouldn't say I looked up the paper. I didn't read it in detail, but I did scan some of the key key figures, and healthcare seemed to be one where there were more breakthroughs, and that sort of fits with what you might expect. I mean, cancer treatment.
There's an economic model promoting breakthroughs.
There's lots of sort of these. I mean, the vaccines for COVID, a huge breakthrough. Whereas in other fields, it maybe hasn't been as much. But I just don't know that I think this is the impediment.
Mm-hmm. I was wondering if this was a role for the AI chatbots, where could you type into ChatGPT, tell me all of the evidence to date about the relationship between this exposure and this endpoint, something like that, in a way this is very, very time intensive. That was my concern in reading this. These are people curating a huge repository of data on a given topic, and and what else could those people be doing? I don't know. I was wondering if there's some way to automate it. And so feeling like, yes, it's a valuable exercise, but maybe this is a role for the chatbot.
So there have been AI, I don't want to call it chatbots, but AI-based programs for meta-analysis. Now, they don't do the meta-analysis. What they effectively do is curate, the ones that I've seen, there may be others.
Finding studies for you?
Right.
They help you try to figure out what you should be reviewing versus what you shouldn't, so you don't have to go through the process of reviewing every single study to figure it out.
Amen to that.
Yeah. So there are these, I think that technology is being used. I do worry about the idea of asking a chatbot to synthesize the literature, because I'm not totally convinced that I understand what it's doing.
Yeah.
But my understanding is it's just mimicking what it thinks you want to hear.
I have such high hopes for these chatbots.
No, I think they will get better.
Right,
I do. And I think they will get to the point where maybe they can do that. But right now it feels to me like what they do is just tell you what it thinks is the next logical thing to say in the sentence.
If since we're on the subject of chatbots, I can't wait to. I have to give you my anecdote. So growing up, I loved this short story writer called H.H. Munro, who goes by the pen name of Saki. I don't know why. And he wrote all sorts of very quirky, weird, mostly nerdy short stories. One of them was about this compound called Filboid Studge, Filboid, Studge, Studge, a totally not made up word. And it was describing this marketing campaign by this company that promoted Filboid Studge to the mothers of the world to promote the healthy growth of their children. And if they weren't doing it, they were, negligent parents, and they made a run on Filboid Studge, and they made tons of money. And of course, the stuff was totally horrible and dreadful and had no benefits. But
it was like an analogy to things that have actually happened.
It was like Marmite. We could say that there's a contemporary example where this could happen. Right?
There goes a huge Marmite, contingent of our audience.
Weird, compound that has found a niche in the world. And of course, I'm a Marmite lover. Anyway, I was so curious about ChatGPT that I wrote to ChatGPT. I went to OpenAI, and I said, write me a paragraph about the health effects of Filboid Studge on the liver. And this is what ChatGPT told me. Filboid Studge is a type of processed food that has been linked to some negative health effects on the liver. Studies have shown that consuming large amounts of Filboid Studge, even in small amounts, can lead to an increase in liver enzymes, as well as an increase in fat deposits in the liver, which can cause fatty liver disease, which I'm sure is true. In addition, an increase in cholesterol, triglycerides, and other fats in the blood can also be linked to consuming too much Filboid Studge. It is important to note that these negative health effects are avoidable by reducing the amount of Filboid Studge consumed and eating a balanced diet, which is fascinating given that Filboid Studge does not actually exist. But thank you, GPT, for coming up with that complete fantasy and an entire literature review of papers that did not actually take place.
It's the end of the world as we know it.
And I was thinking the same thing, that we are doomed.
We're doomed.
Because it says it without a moment's of hesitation and shame that it's just made up an entire literature.
Right.
I'm deeply worried for the future. Okay,
we are doomed.
We can't go down that rabbit hole, because if we do, we're going to have to devote an entire episode to that. Suffice it to say, we all agree we don't think that living evidence syntheses, we think they're a good thing.
We're not sure they are.
Not going to solve the world's scientific problems. Okay, so with that, let's...
Funny and weird.
What?
Wacky and weird, amusing and
weird.
amazing.
Amazing and amusing.
Tricky and trite.
Amazing and amusing. And I'm gonna go first this time, because I somehow, if you remember, managed to forget mine last time. So I was interested in this article in PLOS One. It was from 2021, and the title of it was "When Research is Me Search: How Researchers' Motivations to Pursue a Topic Affect Lay People's Trust in Science." There's nothing in here that is going to surprise you. I just thought it was a nice way of confirming something that you probably would hypothesize, which is me search, meaning people who do research on a particular topic because they are affected by it. And does that affect, and we could have a conversation about whether or not that affects one's ability to actually be objective to the extent that anyone can really be objective in interpreting data. But they were specifically interested in how does it affect other people's inferences about whether or not you trust the research. And so what they did was they made up these sort of evidence summaries on a particular topic. One was around LGBTQ issues and one was around veganism. And they would give these summaries, but then they would also include a statement as to whether or not the researcher was directly part of this community or was a vegan. And then they asked people, they asked questions about whether or not they found the information trustworthy.
You mean like free of bias, trustworthy or
whether
or
or
accurate,
the information was reliable. And because they had randomly allocated the information on the researcher situation, they could get a sense for whether or not it affected people's trust.
I like that. Interesting experiment.
Can you guess? Does it affect people's trust?
I bet it does.
Yeah.
The answer is it depends on what you believed beforehand. So if you were supportive of veganism, you thought veganism was important, knowing that the researcher was a vegan enhanced your acceptance of the work. Whereas if you didn't like veganism or you thought veganism was bad, it had the opposite effect. And to me, this feels really obvious, but I don't know that I've ever seen it proven quite in that way. I'm sure other people have done research on this, but I just thought it was a nice study. And it also made me think, boy, wouldn't it be nice to work in a field where you could do a whole study and learn all this cool stuff just by writing up. I don't mean just by, obviously there's a lot of work and thought that goes into this, but I'm speaking from a budgetary standpoint to be able to do studies like this. Oh, that would be so
It does
nice.
bring up the question though of like, if you start to disclose things as an author about your own personal life, like where do you end? Like you could say I wrote a paper on staph infections and do I have to disclose like my son recently had a staph infection or, how personal do you have to get?
It's a good question.
I don't know.
Where do you draw the limits?
Right. But it's like an interesting parallel with conflict of interest. Like, is it kind of the same as saying I'm writing this article on the effect of cigarette smoking and health and I'm being funded by the cigarette industry and then you view that but if you say you're vegan, does it have the same impact on a study of veganism?
Yeah, I think it's a good question. Right. All right, Chris, what do you got?
Many years ago, for one of our amazing, amusing segments, I talked about this book that I was very fond of called Beethoven's Hair.
I remember it.
Yes, I thought of you.
You saw that article in the Times.
This article about Beethoven's hair recently.
Well, so there was an interesting follow-up to this. And so I will just briefly recap that this author, Russell Martin, had done a forensic history of a snippet of Beethoven's hair. And then he used this to try to understand why Beethoven had died and to try to understand some of his illnesses in life. And the salient findings was that Beethoven was very jaundiced and had cirrhosis when he died, and that the hair samples that they had obtained were laden with lead, very, very toxic levels of lead. And so the conclusion of that book was that he had died of lead poisoning, and this actually lined up very well with a lot of the symptomatology. And it turns out to be completely wrong. So this is a bit of an erratum that a couple years ago, a German graduate student called Tristan Begg, as part of his PhD, got a hold of 8 samples of Beethoven's hair that had been collected by different individuals and sequenced Beethoven. He did like a whole genome sequencing of Beethoven,
and of course they know that these are all
hair
like,
cells. Yeah,
these
so
are
this was
hair
part
because
of this,
they can DNA.
This was the
DNA
part of the
match
story
them.
that was fascinating. That there were these 8 different samples: the Muller, the Berman, the Halm-Thager, the Moscheles, the Stumpf, the Crommelina Brown, the Hiller, and the Kessler. And the one that was in Russell Martin's book was the Hiller sample. Okay, which was allegedly obtained by this guy called Ferdinand Hiller, who was 15 years old and a protege of Beethoven, and was there when he died, and then transferred it to his son, which went down the generations. But it turned out that when they sequenced the Hiller sample, that not only was it obviously not Beethoven, and it was obviously not Beethoven because it was a woman's hair.
Oh.
It was a XX chromosome, so this was definitely not Beethoven. And the genetics was that this was an Ashkenazi Jewish woman.
Wow.
Who was and the wife of the son of Ferdinand had married a Jewish woman in Germany. So the theory is, and they can't prove this, is that the hair may have been lost in a fire and replaced by a snippet of his wife's hair.
Wow.
But of these other 7, one of them couldn't be sequenced at all because there wasn't enough material there. But the other 5 had impeccable lineages, sort of curation lineages. So they were very sure that these had, they were highly confident these had come from Beethoven originally. And then when they sequenced them, they were all genetically identical. So in fact, they were from Beethoven. And this is where it gets very interesting, because when they then looked at the sort of the risk factor data nestled within, Beethoven's 200-year-old genes, they found that he had like a 96% propensity for cirrhotic liver disease if he was exposed to a pathogen. And one of the pathogens they found in the hair cells was hepatitis B.
You can find that in hair cells?
See, this is the interesting thing about the biology of hepatitis B, is that you know how HIV, when it enters a cell, does this swimming upstream trick and then inserts its genome into the host chromosome as a provirus. Hepatitis B does the same thing. And so the hair cells actually have embedded hepatitis B proviruses in the chromosomes of the human chromosomes.
Okay.
And so they were able to show that he had replicative hepatitis B in some of his hair cells. And so that, obviously raises the question whether he might have had congenital hep B, which would be the main cause of hepatitis B back in that era.
Yeah.
Of course, sexual transmission as well, but apparently Beethoven's sex life was not very thrilling. So that seems less likely, according to historians, as opposed to congenital hepatitis B.
Oh.
And the other thing that was sort of interesting about this, or maybe sad, depending how you look at it, is there was a cluster of von Beethoven folks, families living in Belgium, who, when they would introduce themselves as like, I'm Hilda von Beethoven, or whatever her name was, people would say, "Oh, are you related to Ludwig von Beethoven?" And she'd say, "Why, yes, I am." And they'd be like, "Oh, wow, it turns out none of them were related to Beethoven."
Oh.
So that was another kind of like, oh my God, cherished myths falling by the wayside left and right here. Anyway, I thought it was a fascinating.
That is fascinating.
To update the story.
Very cool.
I saw that. And then I saw they were also going to try to follow up with that woman whose hair samples had this excessive lead content.
What was wrong with her?
They were going to try to figure out what happened to her, because that seemed like it was not good news for her.
Well, one thing we know is that she died.
Yeah.
So,
well,
Goodness, right. Happens to the best of us.
Jess, what do you got?
I have one. This is brief, but I thought one of the two of you might pick up on this also. This was an article that my father sent to me as an avid reader of the Wall Street Journal. It's about the paper in Science a couple weeks ago about T-Rexes having lips.
Oh,
I heard about this, but I didn't get the details.
T-Rex had lips, new studies suggest.
That's that's good to know, right?
changes everything.
I know. Listen, famed dino and its kin may not have looked as scary as their popular conception, though some experts are skeptical. Apparently, this has been a raging controversy among scientists who study T-Rex, whether or not they have lips. And this paper in Science is like the definitive comment, although there's still some pushback that maybe this is not correct. But obviously, the reason that he did not, there's some conflict. Although these authors were concluding that T-Rex did in fact have lips. And obviously, when I think of this, don't you think of kind of like Betty Boop? You're thinking of lipstick,
luscious lips,
luscious lips.
Right.
But they don't mean luscious lips. They're looking at were the fangs hanging out of T-Rex's mouth, or did T-Rex kind of like an alligator? Or did he, I'm saying here, did T-Rex have skin flaps over the lip? So maybe he wasn't always like, arr.
Can I ask why would one, first of all, why would one care? And why would one wonder? And how would one know?
So the reason I think that these paleontologists care is because it can relate to the kind of evolution, the kind of evolutionary link between these different types of animals. And so there's certain types of lizards now that have lips equivalent, over their teeth, and others that don't. And they are trying to look at the, elements of the history of dinosaurs. That's my understanding, is that there's something about the evolutionary sequence, and could there be any, remnant, kind of how are these animals related to animals that are living now, some that have lips and some that don't have lips, even though in my mind I still just can't get over this visual of T-Rex with big lipstick lips.
Yeah, with big lipstick lips.
But
I'm with you.
I know they looked in 3 different ways, and so, very scientific. They looked at the relationship between skull length and tooth size for living reptiles like the Komodo dragon.
Do Komodos have lips?
Apparently, yes. And so they do. And so they were saying that if your teeth kind of in relation to your skull was a certain length, then they were covered by lips. And if they were not, then you did not have lips. They also looked at enamel, which was interesting because certain animals like crocodiles, where the teeth are outside of the lips, the enamel weathers really fast. And they saw that the enamel did not weather as fast on their teeth samples. And then they compared like different skulls.
Komodo dragons have lips.
Oh, yeah.
Yep.
Okay. So
Yep.
So anyway, this is like a raging topic right now in paleontology that it was very interesting. And apparently even this article published in Science didn't resolve it because they still have people saying, I don't know, there's room for debate on this. And there, at the end of this article, which was just that I was reading, which was just kind of a recap of this paper in Science, there was a researcher who said the only way to resolve this would be to find an entire mummy of a T-Rex and then look to see if it actually had lips or not.
Well, I guess that's true.
Okay, so let's do that.
Couldn't we just do like
you can't. It's like, why do any research if you're waiting for a mummy? There's no way to resolve
Couldn't we
this
do the
conflict.
Jurassic Park experiment?
Yeah, why can't we just do that?
I know.
And clone a dinosaur and see if they got lips?
Maybe we should start with Beethoven. We could clone Beethoven first.
Beethoven had lips. We
Could we do a chimera?
I am not going to go there.
I just wanted to, if they do have lips, do they kiss each other?
Right. Don't you want to know? It's like so romantic.
So many questions that we are going to have to leave for another episode. So that is the end of our program. If you get any feedback on this or any other episode, or you want to suggest a study or a topic for us to take on, you can tweet us at PopHealthEX, or you can find us.
Are we still tweeting these days?
I took out the tweets because we're not tweeting.
Oh, but they
the
can send us a
school is
tweet.
not tweeting. We can tweet.
We can tweet.
We can tweet, but the school is not tweeting. Or you can find us on the Population Health Exchange website at pophealthex.org. We want to thank Leslie Talalian, Assistant Dean of Lifelong Learning at the BU School of Public Health, for supporting the podcast, and Nick Guler for sound and production, and Mark Tkachky for editing. Thanks for joining us. We hope you enjoyed it, and we hope you'll download our next episode.